Welcome to AETCM, the emergency medicine channel. Today, let us discuss about leptospirosis. It's also called as Weils disease, and in the second phase of the disease, we call it as Weils syndrome. That also we'll discuss. Or Bragg fever. These are all the other names of leptospirosis. Leptospira is a organism that produces fever with other features that is called as leptospirosis. We know that it's a zoonotic disease. Worldwide presence is there. There are more than 1 million cases occur worldwide annually, and some of the patients develop severe leptospirosis, that is Weils syndrome, and mortality rate is very high in that type of patients. 15% is the mortality rate. Most of the time, leptospirosis that is produced by an organism, that is Leptospira, that produces mild fever, some redness of eyes, thrombocytopenia, but most of these patients recover without any problem. But very rarely patient go to the complication that is called as Weils syndrome. That also we'll see. The main contamination of this organism which is occurring through the urine of infected animal. That's why we call it as a zoonotic disease. They come from an animal to the water. Water will be contaminated through wounds in our legs or foot. It can enter to our circulation. That produces symptoms of leptospirosis. So there are different types of organism or serotypes of spirochete, Leptospira. They are coiled organisms that we'll see afterwards. The slide of Leptospira organism we see afterwards. These spirochetes, pathogenic spirochetes, there are different types. One is Treponema, Leptospira, and Borrelia. They produce different types of syndromes that we'll discuss afterwards. The spread is mainly through the contamination of water by the urine of an infected animal, especially rodents. They are the carriers of the disease. They may not develop the problem, they may not develop the disease, but mostly their urine will be infected, and that through that urine will go to a water source, and from water source patient can get infection through small cuts and wounds in the lower limb. So here you can see most important things are cats. They are mostly asymptomatic. They contaminate the water. From the water, the human being will get the disease, especially through the wounds in the legs. Then it will enter to your circulation. It can affect almost all organs in our body: lungs, heart, brain. Everything can be involved in leptospirosis. Now, transmission, we have already told, it's mainly through the breaches in the skin. That means injuries in the skin. So those who are working in flood areas, or those who are working in field during the rainy season, the water will be contaminated. Through that contaminated water, whenever we have an injury to the lower limb, through that person can get the infection. So intact skin also sometimes can produce prolonged exposure. Prolonged exposure can produce infection through intact skin also sometimes. Mucosal membranes also can transmit the pathogen. Ingestion of contaminated water, not very common, but rarely that also can happen. If there is a wound in the oral cavity and all, it can contaminate. But most important thing is, the organism get entry to the human body through the injuries in the lower limb. Now you can see here, there are two important phases for this disease. First phase is just an infection by the organism. You get fever, myalgia, headache, abdominal pain, vomiting, conjunctival redness. Some patients can develop meningitis, uveitis, rash and all, but not very common. And second phase of the disease is immune phase. So initially the organism will be there, spirochete will be there. there will be antibody production against that organism. These antibodies will try to attack our own body, that is immune dysregulation, and produces multi-organ dysfunction syndrome. Okay, so patient can have liver injury, hematological problem, kidney failure, heart injury, all these things. So there are two phases. First phase is only an infection. We call it as leptospirosis. Second phase is an immune-mediated phase. There the bacteria is not producing damage. It is produced by antibodies. They try to attack our organs. The organ injury can occur, failure can occur, patient can develop multi-organ dysfunction syndrome. So that syndrome is called as Weils syndrome. The disease is called as Weils disease, but the syndrome, that syndrome is all these problems. Then we can call it as Weils syndrome. Now, what is the main problem behind this leptospirosis? Whether you take dengue fever or leptospirosis, all areas the problem is vasculitis and vascular leak. That is a major problem in most of the infections, which produces like intravascular compartment collapse, and it can produce various problems. So vasculitis leads to all problems. So here also you can see there are two phases. Anictric phase, that means there is no jaundice. That is the first phase of the disease. Most of the patients fall into that category, and 90% of these patients will recover without any problem. But the other phase is leptospiremic phase or icteric phase. Icteric phase is, that means icteric phase means patient will have jaundice, where the liver is involved. Along with the liver, patient will have renal failure, patient can have myocarditis, pericarditis, patient can also have encephalopathy. All these things can be there. So there are two important phases: simple leptospirosis, that is produced by the bacteria or that is produced by the organism. Second phase is an antibody mediated phase. There the patient develops icteric phase. We can call that phase as icteric phase also, because patient will have liver disease with jaundice. That is one of the common presentation of leptospirosis: fever, high degree fever. Second week onwards they develop jaundice. That's why we call it as icteric phase. So most common clinical finding in leptospirosis: patient can have high degree fever, redness in the eyes, muscle pain, severe proximal muscle tenderness. All these things are common finding. But these findings also can be there in many other viral fevers also. So we cannot tell in initial phase whether it is leptospira, dengue, malaria. All fevers will have similar type of presentation. But second phase is that occurs after 1 week of the disease. That is an antibody mediated disease. There the most important problem will be jaundice. Almost all organs in our body can be involved, like kidney can be involved, lungs can be involved, heart can be involved, muscles can be involved. All these things can be there. So if all these things are there, then we call it as Weils syndrome. So syndrome means a group of diseases. So heart is involved, liver is involved, kidney is involved, muscles are involved, then we call it as Weils syndrome. Otherwise, it's only leptospirosis or Weils disease. The most common like organism, that is Leptospira icterohemorrhagica, Copenhageni. That these are the two like different category of organism which can produce this Weils syndrome or that dangerous multi-organ dysfunction syndrome. So this phase we have already discussed. Anicteric phase. Anicteric phase is only leptospirosis. Organism produces all problems. Second phase is antibody mediated phase. We can call it as icteric phase, that is jaundice is there, or Weils syndrome. There all the organs are involved. We can even call multi-organ dysfunction syndrome. So that is the difference between leptospirosis and Weils syndrome. Both are slightly different but produced by same organism. Here it is produced by the organism itself. Here it is produced by our own antibodies. So it's an antibody mediated phase. The first one is organism mediated phase. Now, one of the most important clinical finding in leptospirosis will be the chest X-ray. You know that when you are seeing a chest X-ray, this is your lungs. You can see here your lungs, and this is the heart. This part is heart. So what you are seeing is throughout the lung field you are seeing non-homogeneous or slightly homogeneous dense shadows, white shadows you are seeing throughout the lung fields. So this can be ARDS, this can be due to various infection, but when you are seeing a Leptospira case, you have to be very careful because pulmonary hemorrhage is one of the most important problem in leptospirosis. This can be simply ARDS, but if it is ARDS, it's only leaking of the contents from the vascular compartment. But here in pulmonary hemorrhage, actual blood itself is coming to the alveoli. So suppose this is your alveoli, full of alveoli is blood. So there will not be any oxygenation to the tissues. So through alveoli, oxygen cannot enter to your circulation. So these type of patients will deteriorate very fast. Pulmonary hemorrhage is one of the strong determinant of uh, high mortality in leptospirosis. So we have to be very careful when we are treating leptospirosis case. If you are seeing white homogeneous shadows throughout the lung field, then there is a high possibility of pulmonary hemorrhage. If you try to intubate this patient through the tube, you can get lot of blood. So there will be a high amount of blood coming through the ET tube. So you can see that indicates pulmonary hemorrhage. These patients' mortality rates are very high. So remember, in pulmonary hemorrhage, mortality rate can be very high than what we described previously, 15%. That may lead to 100% mortality sometime because it is more than an ARDS. It is full of blood in the alveoli. There will not be good resolution even after many days. So we have to be very careful when you are handling this type of patients. Now, how do you diagnose? See, initially, all patients who is having short febrile illness, whether it is leptospirosis, dengue fever, or malaria, all will have any other viral fever, all will have similar type of clinical feature. So, one of the most important investigation you can do in primary settings is urine dark field microscopy. So, this will be urine dark field microscopy. We'll see the picture later. The important thing is you can take a fresh urine and see under dark field microscopy. You can see the actively motile organism in that freshly passed urine. But if you are keeping urine for some time, all the organism will die. You may not get a good result. So freshly passed urine can be used for this dark field microscopy so that the yield will be very high. Next investigation in the acute phase will be PCR. PCR can detect DNA of this Leptospira very early itself. So first week we can either go for dark field microscopy, that's a simple investigation, can be done at any center. PCR is little higher investigation, that also can pick up the organism very early. Second week onwards, the antibodies will be positive. So remember, first week antibody yield will be very less. After 5 to 7 days, these antibodies will be formed in our body, and IgM ELISA can be positive after the first week. Then other investigation, like you can do a complete blood count. There you can see WBC counts are elevated, platelets are low. But platelets are low in dengue, malaria, all other types of fevers also platelets can be low. So it is not a definitive investigation, but it will be low. Creatinine is elevated during the second phase of the disease. That is a very classical finding in leptospirosis comparing to other types of fever, whether it is dengue fever, malaria, or most of the viral fevers. Renal failure is not a common feature, but in leptospirosis, renal failure occurs very early itself. Like you see jaundice in this one, leptospirosis, even renal failure also occur very fast. So any patient who is having high degree fever, muscle pain, elevated CK, if the creatinine also increasing, you have to always think about leptospirosis. And STOT, SGPT will be mildly elevated initially, then it will be in thousands. Creatinine kinase is highly elevated because it is a marker for rhabdomyolysis, one of the very common condition, that is fever with rhabdomyolysis is leptospirosis. Now, dark field microscopy, we have already seen that this can be done in primary settings. You can get a good result if you are doing it with a fresh sample, and if you are not doing with a fresh sample, then the yield will be very poor. That's all. But the clinical expertise, fresh sample, all these things determines the sensitivity and specificity of this investigation. So this can be utilized in a primary or secondary care center. This may not be very useful in a tertiary care center where other investigations are available and they are better than this. And one of the important tests we do in first week of the disease is polymerase chain reaction, that is PCR, that picks up the disease very fast. And second week onwards, you can go for serology. IgM can be done. IgM ELISA is the most important investigation we do in second week. Now that has got a sensitivity of 35 to 76% and specificity of 69%, and we do IgM antibodies. IgG also can be positive in some patients that can indicate a previous infection, but not an acute infection. And MAT test also can be done. That is available in some centers. I am not going to the details of this investigation. Some centers, these investigations are available. This is Leptospira interrogans organism, tightly coiled, highly motile spirochete bacterium. If you are seeing under dark field microscopy, you can see the organism is moving like this. There will be fastly moving organism. So that can be picked up. Now there is a criteria called as modified Fain's criteria, and you can pick up the disease very early itself. That's a clinical diagnosis, and some lab investigations also added to that Fain's criteria. And if you have clinical suspicion and you are not able to make a proper diagnosis because you are not experienced, then you can use this type of criteria to make a diagnosis. But in India, the number of cases are very high. Most of the doctors are able to pick up this disease in early itself. So I am not going to the details of this modified Fain's criteria, but there is a criteria available to make a diagnosis of leptospirosis. Now, how do you treat leptospirosis? That is very important. Leptospirosis is not an organism which has got lot of resistance against antibiotics. Most of the simple antibiotics can be used to kill the organism, including doxycycline, amoxicillin, azithromycin, penicillin. Penicillin is crystalline penicillin, ceftriaxone. Any antibiotic, for that matter, any antibiotic, Leptospira can be treated easily. But remember, all these antibiotics will be acting only in the first few days. Like you have two phases. One is leptospirosis, other one is Weils syndrome. We already told that Weils syndrome is due to antibody mediated problem. So all these problems you can treat, all this antibiotic it can be useful only in the first phase of the disease. Once the patient develops antibody mediated multi-organ dysfunction syndrome, these antibiotics will not be effective. So there you cannot use, but if you are having a patient who is having suspected leptospirosis, as soon as possible you have to start the antibiotic. Once they go to the antibody mediated phase, you cannot treat the patient with this antibiotic. Even then we can continue the antibiotic because the number of organisms, they are very high. The further progression of the antibody mediated multi-organ dysfunction can be minimized. That's all. So you can give doxycycline 100 milligram BD if the patient coming to the clinic, and you can even give that as a IV. Amoxicillin can be given 500 milligram QID, or amoxicillin like augmentin can be given for 7 days. Azithromycin 500 milligram once daily. Crystalline penicillin can be given. Ceftriaxone also can be given. Now, when you see the patient on this and any of this antibiotic, if the patient develops ARDS, just imagine ARDS, many doctors go for a higher antibiotic. That is not required, because ARDS is not because of the Leptospira, it is due to the immune phase. So even if you give a meropenem here, nothing more can be done by meropenem. because it is due to immune mediated phase, and some doctors falsely add crystalline penicillin with meropenem. That is also not required. If you are starting meropenem, that itself can kill the organism. So there is no point in adding another antibiotic which is similar to meropenem. So if you are giving one antibiotic, that is more than sufficient in a clear-cut case of leptospirosis. But if the ARDS patient is going for ventilator-associated pneumonia, then depending on the clinical scenario, you have to hike up the antibiotic. Otherwise, single antibiotic is more than sufficient to treat the leptospirosis, and even single dose of crystalline penicillin can kill all the organism in our body. But the problem is this antibody mediated problem that cannot be minimized by your antibiotic. Now, preventive measures, the most important preventive measure is reducing direct contact with flood waters, like it mainly occurring due to the flood situation. So, prevent the direct contact and avoid injuries in the lower limb. That these two things can prevent this one. And if you are going to an area where there is a lot of contamination, especially in flood areas, you can take doxycycline. So that also can be given to prevent the minimize the infection. So we have discussed about one of the most important zoonotic disease in our country, that is leptospirosis. So we have already seen how it spreads from the reservoir to human body. What are the clinical phases like anectric phase, ectric phase, or leptospirosis to an antibody mediated phase. When you diagnose it, the most of the antibiotic which are available, even a simple antibiotic like crystalline penicillin itself can kill all the organism. There is no point in hiking up the antibiotic unnecessarily. The simple antibiotic itself can kill. But if the patient is going to ARDS and associated ventilator pneumonia, then you can hike up the dose, or any hospital acquired infection, you can hike up the antibiotic. Otherwise, simple crystalline penicillin itself is more than sufficient to treat the leptospirosis. There is no resistance reported so far. Thank you.